This is an off-the-chart special report. Welcome to a special episode of Off the Chart, Business and Medicine podcast. I'm Austin Luttrell, Assistant Editor at Medical Economics, and I'd like to thank you for joining us today. On July 30th, 1965, President Lyndon B. Johnson signed Medicare into law at the Truman Library in Independence, Missouri, fulfilling a vision that President Harry Truman had first proposed 2 decades earlier. At that ceremony, Johnson handed Truman the very first Medicare card and called him the real daddy of Medicare. Today, 60 years later, more than 66 million Americans depend on the program. In this special report, Medical Economics Senior Editor Richard Payerchin speaks with President Truman's eldest grandson, Clifton Truman Daniel, and Mark Adams, the director of the Truman Library. They reflect on Medicare's legacy, Truman's push for universal care, and how his ideas still resonate in today's health policy debates. Thanks again to Clifton and Mark for the conversation, and now let's get into 60 years of Medicare.
I'm Richard Payerchin, reporting for Medical Economics. With me today are two guests. Clifton Truman Daniel is the eldest grandson of President Harry S. Truman, and he serves as honorary chair of the Truman Library Institute. Thank you for joining us today.
Thanks for having me.
And Mark Adams is director of the Harry S. Truman Library and Museum in Independence, Missouri. Thank you also for being here.
Thank you for the invitation.
Absolutely. And sort of a unique element to healthcare that we're going to discuss today, because it's going to involve an anniversary coming up about Medicare, which is definitely important to our physician audience. Before we get into those details, can you both introduce yourselves a little bit with some background, some information about your family background and research and historical interests?
Again, as you said, I'm Clifton Truman Daniel. I'm Harry and Bess Truman's oldest grandson. I had a dual career at a desk. The first half of it was as a reporter and editor for a New York Times-owned paper in Wilmington, North Carolina. And the second half of it was as the public relations director for Harry S. Truman College in Chicago. Not sure how I got that job. And I have since taken early retirement. I have been lecturing on my grandfather's presidency, other presidencies. I am a founding member of the Society of Presidential Descendants, so I talk about other descendants behind their backs. And I also play my own grandfather on stage in the one-man show, Give 'Em Hell Harry. Strangest retirement program ever.
And I'm Mark Adams, as you said, director of the Presidential Library, Truman Presidential Library and Museum in Independence, Missouri. I've worked here 28 years. Started in 1997. I've been the director, though, just since January of this year, so just about 7 months. Being here for 28 years, I started out as the education director, and then after that, I was the museum curator and now the director of the Library Museum. I've previously worked at the Kansas State Museum in Topeka, Kansas for 6 years. And you might notice an accent. I'm originally from Liverpool, England, where I was born, and went to school there and moved here in the early 90s.
And July 30th marks the 60th anniversary of President Lyndon B. Johnson signing the Medicare and Medicaid Act into law. But there is a unique historic connection with President Harry S. Truman. Can you explain that connection?
I mean, I'm still, I was talking to Mark a little earlier, and I am still friends with President Johnson's daughters, Linda and Lucy. So the family connection is still there. My grandfather, I think, in terms of this conversation, and he was friends with President Johnson regardless, but in terms of this conversation, it was because after years of trying to establish universal health care during his own presidency, President Johnson got that done, and my grandfather was very grateful for that. If you look at the film clips from the event, or even the still pictures, you can see that my grandfather is mostly smiling from ear to ear. He was grateful to President Johnson, thought it was a job well done, and he was just delighted by the whole thing and gratified. Lucy Johnson said also she had asked her father, I guess, in the run-up to that event, she said, "Why are we doing this in Independence, Missouri? Shouldn't we do this at the Capitol? Shouldn't this be at the White House?" And her father turned around and said, "Because of his efforts, I'm able to get this done. He laid the groundwork, and nobody deserves to have the first and second cars more than Mr. and Mrs. Truman." So he went straight for independence to do that ceremony.
Especially, I'll be perfectly candid, I wasn't aware of that connection until just this month. But it's always interesting to learn, about the different historical elements that take place in every presidency. Mark, could you talk a little bit about maybe that connection? And I guess what was surprising or striking to you about that?
Yeah, I think part of it reflects the great friendship that they did have. They exchanged Christmas greetings. They would call each other on Christmas holidays. The two first ladies, Lady Bird and Bess Truman, were also great friends. So it talks some about their friendship. But, LBJ really wanted to recognize Truman's contribution. So to come here in the building I'm sitting in right now at the Presidential Library, on the stage, in the auditorium, and sign this landmark piece of legislation in 1965 with President Truman sitting at his side just tells you a lot about LBJ as much as it tells you about Harry Truman, the amount of respect they had for one another, for their great friendship. It is unusual to have a piece of legislation, signed in a different president's, building. So that shows you really the level of thought that LBJ had for Truman and what he had tried to do in his presidency. Truman said it was one of his greatest disappointments that he wasn't able to pass that during his 2 terms. But LBJ came through for him, signed it here, gave him the pens, came back later and gave him the first 2 cards to him and his wife. So I think it just says a lot about their relationship.
Yeah, they only had, Mark knows this story, they only had one rift in their friendships when Lady Bird called my grandmother in 1965 after LBJ had won election in his own right and said, "Mrs. Truman, we want to rehang your official portrait, but we can't find it." My grandmother said, "That's because it's on my wall." And Mrs. Johnson said, "That doesn't belong to you. That belongs to the American people." My grandmother says, "It does not. It's a picture of me and it's on my wall and that's where it's going to stay." And Mrs. Johnson argued no longer, but commissioned the artist Greta Kempton to paint 2 copies. One is in the White House collection. One is now on the wall of Mark's building down there in Independence, Missouri at the Truman Library. The original is still on my grandmother's wall.
Say, Keith, this is all well and good, but what if someone is looking for more clinical information?
Oh, then they want to check out our sister site, PatientCareOnline.com, the leading clinical resource for primary care physicians. Again, that's PatientCareOnline.com.
Just not being an elected official myself, you look at, especially at the highest levels, the presidency of the United States is the leader, the president is the leader of the free world. And, sometimes it may be easy to forget that they're human too. And they have friends. They have people that they like. They probably have personalities that they sometimes kind of rub the wrong way, back and forth. So I really like that personal connection.
They had a very good friendship, and then the friendship obviously survived the great painting debacle.
If that's the worst thing that happens in a relationship, then hopefully that's a pretty strong relationship. You know what? One of the things that was really striking to me in looking at some of the historical archives, President Truman's special message to Congress in November 1945 shows that he had a pretty sophisticated understanding about problems in the American healthcare system in the aftermath of World War II. Why did that issue of healthcare become so important to him?
I think that President Truman, it was like part of his deal program. He was trying to rebuild really the country after World War II. He's looking at housing. He's looking at rebuilding the country. He's concerned about national security, civil rights, and he saw healthcare as just part of that, of this Fair Deal program. A lot of those different pieces, unfortunately for him, didn't get passed, but he just saw healthcare as being this really a right for the American people. And he had seen, as Clifton will talk about, I'm sure, the rates of health before World War II and soldiers that weren't passing the medical tests and things like that, that it certainly needed addressing. But he just saw it part of his Fair Deal program, his huge domestic agenda that he had. But he also looked at the world, and he was also concerned about national security, and that he wanted a healthy populace with, building new hospitals. And it's not just about giving everybody health care. There's a lot of other repeaters to the initiative that he was trying to put forward, increasing medical awareness, increasing medical education, improving the quality of doctors, and so on.
Yeah, as Mark was saying, that I think they found that during the war, 1 out of every 3 recruits, or more than 8 million Americans, were unfit for military service. They could not cut the physical aspects of it. And he was appalled that many people were unhealthy, too unhealthy to serve. Beyond that, after the war, and what Mark said about strength is exactly what Grandpa was thinking. A country's strength depends on the strength of its people, and that means not only access to health care, but housing. You need a roof over your head. You need to have a job. He was also, as part of the Fair Deal, he was looking at creating full employment by supporting businesses, supporting large and small businesses. So he was looking at the whole package of strengthening the backbone of this country, which are people.
President Truman was particular about the role of physicians and the importance of medical education. How did he envision the role of physician leadership in the healthcare system?
It's an interesting question to sort of turn it around on you, because, of course, what he talked about in his memoirs and talked about in other places was one of the problems facing his healthcare agenda was the AMA, not run-of-the-mill physicians, not the folks on the front lines, but the folks way up at the top who opposed universal health care on the grounds that it was, and I believe they came up with the term socialized medicine. I'm sure they weren't the only ones. But so that was his real issue, was with the top tier. I think he had a great affinity for doctors and nurses, in the same way that he always fought with newspaper publishers, but he got along great with reporters and photographers. So it was the leadership that was stymieing him. He depended, or would have liked to have depended, on universal health care on a decentralized system. He wanted this to be run by the states, by local communities, therefore by local doctors and local nurses, to determine how they carried out their own careers and how they helped their patients.
And maybe not to belabor that point, but I did notice among some of those historical documents also, I came across that quote in the address to the American Hospital Association from 1952, when the president said, "I have recommended programs which I believe will provide better medical and health services for all our people. Some groups have received these proposals enthusiastically, others have been strongly against them." When President Truman began proposing a potential health and disability insurance program, who were some of the supporters?
I mean, the most obvious group is going to be his fellow liberal Democrats, but he also got lots of support from the labor unions. They saw that the health benefits would benefit their members. There were a number of different foundations and funds that were advocates of health policy reform, I guess you could put it. Those involved, like the Rockefeller Foundation, the Carnegie Corporation, the Milbank Memorial Fund, all of these big groups that were really looking at improving social work and looking at really where, like, the idea of being on a local level rather than from the top. Those are the ones in favor. In fact, some healthcare initiatives have been tried under the FDR administration. John Dingell Sr., a Michigan congressman, had put forward a bill in 1943 calling for national health insurance, and just like Truman's, it didn't succeed. I think the opposition is interesting too, though. Clifton mentioned the American Medical Association already. Certainly the conservative Republicans were worried. I think the other piece of it too is that idea of it being labeled socialized medicine for the first time, that did put people off, along with some concerns about increased taxation to help pay for the program.
Taxes and the perception of taxes is never an easy sell. So,
Right.
on the other hand, I mean, clearly he wasn't the only one who had recognized some of those problems that he outlined, in his address to Congress. So, I'm sure that didn't exist in a vacuum.
I mean, some of these initiatives had started under Teddy Roosevelt at the turn of the century. He used it as part of his 1912 campaign that he lost. That was part of his campaign then. So it's certainly been, been being discussed for the last 40 years prior to Truman's presidency, for sure.
You know what? I was curious about the time, not just during his presidency, but after, from 1945 to 1965. Can you describe that social and historical context that developed that allowed the development of even more support for programs such as Medicare and Medicaid?
President Kennedy did he actually called for health coverage for older Americans. So we're getting more into the Medicaid side of things in 1961. There was the Kerr-Mills Act of 1960, which provided federal grants to states to cover health care for the elderly, particularly the poor. But that wasn't very effective, with limited state participation. I think the thing that helps Lyndon Johnson in the 60s is his Great Society plan, because that really starts this whole social agenda reform with the Civil Rights Movement. In 1964, you have the Civil Rights Act, the Voting Rights Act of 1965. This social and political climate behind all of that, there's social welfare reforms really help when it comes to passing the Medicare bill in 1965.
And once President Truman was out of office, frankly, I guess I don't know enough to know. Did he continue to maintain observation about the different political developments in the nation, whether it be with healthcare and certainly the range of other topics that presidents deal with?
Yeah, he was interested. He was interested all of his life in what was going on. I think he was a bit less engaged than he was when he was in office, and less engaged as he got older. There are some fun stories about his friendship with President Hoover. Both of them were the elder statesmen during the 1952 and 1956 presidential campaigns, and both were trotted out by their respective parties to shill for the candidates. And of course, they would in public, Grandpa would say these horrible things about President Hoover. If you want to go back to Hoover carts, vote Republican. And then he'd have to call President Hoover that night and say, "Hey, I'm sorry. I don't mean it." And President Hoover, "Well, yeah, I know. That's okay. Besides, I'm going after you tomorrow. So sleep well." But they put it all aside. So he kept that up in the 50s, I think. But as he began to get older, he was less actively engaged. That's not to say he didn't have, we were talking earlier about LBJ called him regularly just to chat, to get advice, to tell him what was going on, to see what he thought. President Kennedy called him during the Bay of Pigs and the Cuban Missile Crisis. So he was talking to ex-presidents. He knew what was going on. But I think he felt that the elder statesman role was not to go poking your nose too deeply in and making a nuisance of yourself. Of course, George W. Bush has taken that to new heights. When he left, it's like, no, don't talk to me. I'm not, nope, not doing it. Going home to paint. Take care of my ranch. Leave me alone. So less engaged as he got older.
No, that's an interesting level of involvement, only because somebody, clearly has just tons of experience in dealing with things. And yet, when you're not in that role, just like you said, you don't necessarily want to impose yourself in a role that maybe you're not there anymore. So, A question for you, if I may. This was something, again, looking at some of those historical documents, the 5 basic problems that President Truman outlined across healthcare in 1945, the number and distribution of doctors and hospitals, need for public health services and maternal and child care, medical research and professional education, high cost of individual medical care, loss of earnings when patients get sick. Thankfully, since that time, there have been many scientific and policy advances, that we've experienced in our lifetimes. And yet, in 2025, we're still talking about some of these issues. What do you think President Truman's response would be?
I think there's a quote that you've obviously heard before from my grandfather. There's nothing new in the world but the history you don't know. And we as a country, we as human beings tend to repeat ourselves over and over and over and re-argue and re-legislate the same problems generation after generation. In the play, Give 'Em Hell, Harry, people sometimes ooh and ah in the audience because they think that as grandpa, I'm taking pot shots at the current administration, but it isn't. It's taking pot shots at the then Nixon administration or the 80th Republican Congress, whatever. But it still sounds like we're talking about 2025, not 1945. We just do that, sadly, over and over again. So I think he'd be disappointed, to answer the question directly. He'd be disappointed, but I don't think he'd be surprised.
Mark, anything to add in kind of a historical context about that one?
Yeah, I think that, we'd said before how he was disappointed at the end of his second term that he was not able to get legislation passed, as we've talked about. I think he was, as Clifton said, he was all smiles in the 1960s when LBJ signed that legislation here. I think that would have one of his kind of crowning achievements in post-presidency that he could really point to. So I think today it's hard to comment. It's hard to make a comparison. I think he would say we've still got a long way to go, just like some other issues that he faced, like civil rights and others. He dealt with the problems in the Middle East. I think he would look at today's world and say we've still got a long way to go.
Hey there, Keith Reynolds here, and welcome to the P2 Management Minute. In just 60 seconds, we deliver proven, real-world tactics you can plug into your practice today, whether that means speeding up check-in, lifting staff morale, or nudging patient satisfaction north. No theory, no fluff, just the kind of guidance that fits between appointments and moves the needle before lunch. But the best ideas don't all come from our newsroom. They come from you. Got a clever workflow hack, an employee engagement win, or a lesson learned the hard way? I want to feature it. Shoot me an email at kreynolds@mjhlifesciences.com with your topic, quick outline, or even a smartphone clip. We'll handle the rest and get your insights in front of your peers nationwide. Let's make every minute count together. Thanks for watching, and I'll see you in the next P2 Management Minute.
And again, not to rely on those historical documents too much, but firstly, I'm grateful because I actually, in a short amount of time, learned a heck of a lot. So thank you for kind of bringing those to our attention. But one thing, and you mentioned also earlier in conversation that really caught my ear, was about the notion of a decentralized system. And in President Truman's comments in the rear platform remarks in Minnesota and Wisconsin, he noted that federal laws would not be enough to create and sustain any kind of successful healthcare program. He did encourage that state and local government involvement, medical schools and hospitals, doctors and civic groups. Can you talk a little bit more about why those are such important elements in his vision?
Yeah, I'm glad you brought that up. I think that he really did emphasize it being a decentralized program. And he felt like it could be tailored to local conditions, local needs, local environment, rather than be a top-down approach. So I think he felt like that state and local agencies could be trusted to do that. In terms of the medical schools and hospitals, I think we mentioned before, we had this idea that larger, well-equipped hospitals could help support smaller hospitals in a coordinated system. I think he felt like the local doctors that we mentioned earlier, would be able to remain free to participate and choose their own patients. And he would really engage civics groups so that they could help improve public health. He talked a lot about, the ideas of sanitary conditions and things like that. That's a local issue, right? So it felt like it could improve economic productivity at a local level and improve local public health. So really his idea of centralized administration of this and expanding the resource and engaging the local professionals and local communities was to make sure that the program was more comprehensive and more responsive to local needs.
One of the things, when we talk about these type programs, I made a long career as a community journalist. And so one of the things that my editors emphasized for years and years was to, people want to find out what's going to affect their pocketbook. They're going to find out how it affects their kids' schools. They're going to want to find out about how, it's going to affect their lives when they show up on the job. And where I'm going with this is, the Truman Library has published some information sheets that talk about improvements to Americans' life expectancy from the time the bill was signed until now. And I know there's been some debate recently about different factors that have actually hurt life expectancy in America, and yet life expectancy in year 2025 still is greater than in 1965. How do you think President Truman would have felt about that?
Well, that was certainly one of his goals, was to make the country healthier, to make everybody healthier. And so I think he would be pleased at that statistic. Absolutely. Clifton may want to add more to that.
No, I agree. That was his goal. And again, back a little bit to the decentralization, empowering local doctors, local nurses, local hospitals to take care of their patients in the way that their patients needed to be taken care of, which improves everybody's health. And all that they really need is the federal government's approval and support. Give them some, back them up. Let them do their jobs. Give people access. You're going to have an education, health, prevention, preventative medicine. All of that builds I've said it before, builds a healthier, stronger country.
This is a huge topic. We've had a great introduction, and I'm so grateful to you both for taking the time this afternoon. We covered a lot of ground in a short amount of time. What points did I not ask about that you would really like our audience to know?
I can't think of it. I talked a while ago about the fact that my grandfather's health was always good. I mean, he lived to be 88 years old. My grandmother was 97, still the oldest first lady this country has ever had. If you read their letters back and forth, she worried about his health, and he always had to tell her he was fine. She worried about what he was eating, what he was doing. He had diphtheria as a child and was paralyzed for nearly a year, but was seldom sick after that. So good health was something on his mind. And both of his parents got very sick. His father died of peritonitis after getting a hernia, moving a boulder out of the road as a road overseer. But his mother was similarly ill. So, illness affected his family. My grandpa was on the front lines of World War I, and my grandmother was home. She was the one closer to death. She contracted the Spanish flu and was sick for weeks and weeks and weeks. They thought they were going to lose her. And she lost a lot of the hearing in her left ear because of the infection. So health, always on his mind, always on her mind, something very important to them. And my grandparents were people who believed that if it was important to them, it was important to everybody else, and they ought to have the means to achieve it.
And in her letters to him, there's a few of them that survive from Bess to Harry. She's often bantering him about his health, telling him to take a rest, take a break, go see the doctor, things like that you see in her personal letters to him, particularly in the 1920s and the 1930s.
Yep, when he was traveling, when he was National Guard encampment, or flying around in airplanes as a senator, she hated that. And all these wonderful, the health issues go down through the generations, Richard. My grandfather had very bad eyesight. I had to get holes drilled in both my eyes to equalize the fluid because I have similarly shaped eyeballs as my grandfather. I am prone to heart palpitations when I get stressed. He had the same thing, which was why my grandmother was always fretting about him. So, DNA, what fun.
I was going to say there's always a element of, we do our best. All of us do our best with what we've got, but sometimes it's tough to escape the genes.
Well, I'm waiting for, I don't know that I want to make it to 97, but there's a good track record out there.
If I have other follow-up questions, I'd like to reach out by email here, but I really do thank you both for taking the time. I've enjoyed this assignment. I learned a heck of a lot, and I think our readers are going to get a kick out of it. So thank you.
No, thank you. Thanks for having us on.
Oh, yeah.
Thank you.
Once again, that was a conversation between medical economics senior editor Richard Payerchin, Clifton Truman Daniel, the eldest grandson of President Harry Truman, and Mark Adams, director of the Truman Library. My name is Austin Luttrell, and on behalf of the whole medical economics and physicians practice teams, I'd like to thank you for listening to the show, and ask that you please subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts so you don't miss future episodes. Also, if you'd like the best stories that medical economics and physicians practice publish delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Off the Chart, a business and medicine podcast, is executive produced by Chris Mazzolini and Keith Reynolds and produced by Austin Luttrell. Medical economics, physicians practice, and patient care online are all members of the MJH Life Sciences family. Thank you.